AWANI tonight with me, Farhana Sheikh. Prime Minister unveils Pemulih aid package worth 150 billion ringgit. And can states or territories move away from the national pandemic strategy? That's coming up. Sabah will be opening up more sectors as part of the territory's recovery phase, such as limited dine-in at restaurants and hotels starting tomorrow. Chief Minister Datuk Seri Haji Noor said in a statement that as part of the state's recovery plan, most of the SOPs will be maintained except for some social and economic sectors.
Barbershops and hair salons that offer cutting services as well as roadside stalls selling vegetables, fishes and fruits will be allowed to operate. Sports and recreational activities that do not involve physical contact, such as golf, fishing and cycling, will also be allowed. However, the detailed SOPs will be announced soon. The lifting of SOPs comes as Sabah has been recording less than 200 daily new cases of COVID-19, while its vaccination rate has also increased to some 12,000 jabs a day.
This is not the first time Sabah has moved away from the federal government's strategy in managing the pandemic. UiTM Sabah Senior Lecturer in Political Economy, Dr. Firdausi Sufyan, talks about the move in balancing lives and livelihood.
Yeah, if you look at it, what we can understand from this decision is that if you look at early this year, when the government announced to have PKP, well, in fact, Sabah didn't actually follow. So they imposed PKPB. So I guess this is one thing that the Sabah government actually look at. They don't want to risk the economy, because if you look at lockdown, it is a necessary evil, but it should be temporary. Because if you prolong lockdown, it would definitely have adverse impact to the economy. Now, if you look at Sabah economy, last year was recorded, the GDP was recorded negative 14 or negative 14 or 15. So that's really bad. Now, so for them not to follow is because there's a lot of economic consideration, I think, from my perspective, because in order to bounce back, to go back on track, so they have to make a bit relaxed in terms of the regulation. So, like, for instance, like dine-in, I think Sabah is the only state that actually allow dine-in, and other businesses as well. They're allowed to operate. Now, there are a few things that actually, if we want to look at Sabah, number of cases, well, yes, it is quite low. We're doing quite well, and then in terms of the healthcare capacity, is quite good. It's quite okay in terms of responding the COVID-19. But the key here is that is the vaccination, the rate of vaccination. Now, so the consideration to open up to be more relaxed, I think, is reasonable in order to protect the economy. But if after they are relaxed, they don't follow basically the federal government the rules for PKP. But what they need to do is to increase the vaccination.
Meanwhile, state government will have to increase their capacity of COVID-19 vaccine use by more than 90% starting next month. This, according to Coordinating Minister of the National COVID-19 Immunization Programme, Khairi Jamaluddin, is to avoid vaccines being left unused and wasted in the refrigerator, as more vaccines are expected to arrive in July.
Meanwhile, the government has allowed the Selangor state government to begin its vaccination program as a complement to PIC. Khairi has refuted an allegation that the federal government did not send enough COVID-19 vaccines to Selangor. He said that as of yesterday, Selangor had received 1,367,306 doses of the vaccines, with more than 300,000 had yet to be dispensed. He urged the Selangor government to speed up the vaccination rate as its vaccine usage at 76% was the lowest among the states in the country. Starting next month, Khairi said that the vaccination capacity in Selangor will be increased to 130,000 doses daily.
The government has unveiled the National People's Wellbeing and Economic Recovery Package, or Pemulih, worth 150 billion ringgit. Prime Minister Tan Sri Muhyiddin Yassin said it comprises of the government's direct physical injection of 10 billion ringgit to be channeled towards low and middle income households affected by this public health crisis.
400 million ringgit will be allocated to increase national vaccine supply, while additional 200 million ringgit dedicated for increasing and updating PPVs, including mobile PPVs and vaccine outreach programs. 6 months automatic moratorium will also be given to all borrowers, while 10 million ringgit will be allocated for food basket assistance, specifically for the Orang Asli community. 5 to 40% discount on electricity bill for 3 months will begin in July. Meanwhile, a 3.8 billion ringgit allocation under the Wage Subsidy Programme 4.0 is to benefit 2.5 million workers, with no more salary limit conditions set. EPF will also introduce a new withdrawal facility called iCitra, where a total of 12.6 million EPF members can make withdrawals of up to 5,000 ringgit, with a fixed payment rate of 1,000 ringgit per month for 5 months, subject to the members' total EPF savings.
With the Pemulih aid package announced, do the measures underlined tackle the current challenges faced by those affected? We speak to Bank Islam Malaysia Berhad Chief Economist, Dr. Muhammad Afzal Nizam Abdul Rashid.
Well, the way I see it, the government is trying their best to address everyone's plight. Those who are in the hardcore poverty, there will be a cash transfers program. The businesses, there will be financing scheme, even for the microcredit. And also those who are in the M40, in the T20, perhaps the automatic loan moratoriums should have helped them in terms of giving up the assistance. So the government is trying to cover all angles, all aspects, and trying their best to ensure that everyone is taken care of.
Therefore, what should be focused on next?
What is more important now is to ensure that the recovery plan, the national recovery plan, is on track. I think the government has actually shared what are the phases and what are the indicators to be met in order for the country to migrate to the next phases. So I think all efforts should be galvanized to ensure that we will be able to migrate to the next phase so that the reopening of the economy can happen more convincingly. So I think that's the most important thing that we need to focus on. And in terms of assistance, I think the government has shared a lot of things. And of course, what matters now is to ensure that everyone will receive it and try to make use of it to the best of their ability. To ensure that it will create the required, multiplier effects in the economy that could essentially help to promote a better growth going forward. So, in a nutshell, the government has done their level best to cover almost everyone in the economy, and what more important now is to ensure that the recovery plan is on track, the vaccination program is on track, so that we could actually achieve the so-called herd immunity within the stipulated time.
We'll take a short break. Stay with us. Welcome back. Perth is the latest Australian city to go into lockdown at midnight as an outbreak that began in Sydney spread across the country. The 4-day lockdown was imposed in Perth and around the Peel region after a third case of COVID-19 was discovered in the community. More than 130 locally acquired infections linked to the Sydney case has emerged since 16th of June. The escalation in cases has also prompted lockdowns in parts of Sydney and Darwin too. Australia has been relatively successful in containing COVID-19 through lockdowns and strict border restrictions. But the new clusters have highlighted the nation's slow vaccine rollout, with only 5% of the population fully vaccinated. Indonesia's Food and Drug Agency has recommended China's Sinovac COVID-19 vaccine for children aged 12 to 17. The country is on a race to speed up vaccinations amid a surge in infections of more transmissible variants.
Indonesia has been using Sinovac as the main plank for its vaccination program after receiving about 94 million doses, while it has received about 10 million made by AstraZeneca and Sinopharm. Data shows children aged 0 to 18 account for 12.6% of Indonesians' total COVID-19 infections. The WHO approved emergency use of Sinovac's vaccine this month, saying results showed it prevented symptomatic disease in 51% of recipients and prevented severe COVID-19 and hospital stays.
A total of 9 people are confirmed dead from the collapse of a condo building in Florida 5 days ago. More than 150 people are still missing. Rescue workers are working around the clock in hopes of finding survivors, even though no one has been pulled out alive since the first day the structure fell. What caused nearly half of the 12-story building to collapse has yet to be determined. But an engineer's inspection report in 2018 found major structural deterioration in the parking garage beneath the 40-year-old tower. Swedish Prime Minister Stefan Löfven has resigned after he lost a vote of no confidence last week, the first time a premier was ousted in such a motion in the country. With him stepping down, the parliament speaker will have to begin cross-party negotiations to form a new government.
Löfven lost the confidence vote after the Left Party withdrew its support. He has until midnight tonight to find fresh backing in parliament and try to stitch together a new coalition, with the expectation of being reappointed. Failing that, he can let the opposition have a go at forming a government or call a snap election. Löfven, however, warned that an early election during a pandemic would be a bad outcome.
Hong Kong police arrested a former senior journalist with the Apple Daily newspaper at the airport as he was trying to leave the country. The police in a statement confirmed they arrested a 57-year-old man on a suspected national security charge.
Local media identified the journalist as Fong Wai Kong, who was attempting to board a flight to London when arrested. Fong would be the 7th staffer at the pro-democracy paper to be arrested on national security grounds in recent weeks. Earlier this month, authorities froze $2.3 million worth of assets linked to Apple Daily. Last week, the paper printed its final edition and ceased operations, citing employee safety and an inability to pay wages.
Sungai Buloh Hospital, as the country's main COVID-19 treatment facility, has had to adapt quickly to keep up with the evolving disease. Tonight on Consider This, we speak to infectious diseases specialist Dr. Benedict Sim about the adaptability of our healthcare system. That is all we have for you on AWANI tonight. Get the latest news update on COVID-19 and COVID-19 vaccines from astroawani.com and Astro AWANI app. I'm Farhana Sheikh. We'll see you again.